so we can observe if we're having any extra drainage, or maybe we might express some clots into the pad, so we might be concerned with that. Okay, so also after we've done that and we've observed our lochia, so here I have some examples. So what would we call this one?
Scant.
Okay, scant. And then we have moderate and
saturated.
Yeah, large. Usually it says large.
Scant, moderate.
And then it will say with clots or without clots. So, okay. So then once we are observing that too, we can also observe the perineum. So we're going to look and we're going to assess that by Rita. So what does that stand for?
Redness, edema, ecchymosis, drainage, and
yeah, in amount.
no, approximation from the
So we'll probably see
suture.
that with episiotomy. So we will see, make sure that none of them sutures have torn. Okay, so that's good. Okay, so then what's some patient teaching we're going to teach for perineal care or comfort care with our moms there? How are we going to teach her?
Ice first.
Okay.
Blot.
Okay,
Ice
blot.
for 12 hours.
Okay, so we usually have our peri bottle. So what are we going to say to how to use our peri bottle?
Warm water.
Warm water.
And spray it front to back.
Spray front to back. And then blot to pat to dry. And then how are we to take our pads away and place them?
Front to back.
Okay, perfect. Okay. Then how are we going to layer these pads? So here's the pads that they had.
Then this.
Yep, we can use our ice pack.
And then we put the top
with lidocaine. And we wouldn't have to use this until later. So, yeah, so that will provide some
like
comfort measures.
perineal
Would you put like
pizza.
4, 6? Perineal pizza. Oh, that is so
That's
good.
going to be a new one on the
that
menu.
is. That's a really good one.
You put the tucks on there like the
Would you say 4 or
pepperoni.
6 of these? Doesn't matter.
I usually,
Put
I don't know. I
Just
just put
do
how
'em?
many ever.
Okay.
Yeah.
Dip that pepperoni
And
in
then,
some Alfredo sauce.
Some lidocaine.
Then, what was I going to say? Oh, we also have sprays that we can give them too. And that has lidocaine and stuff in them that also helps. So if they're having quite a bit of pain with that, they can do that. Okay, so the next thing we're going to assess is our latch score. And that is we're going to look at, check the breasts. And usually this can be done when you assist the mom to their first breastfeeding. So you can notice if their breasts are engorged, what type of nipple they have, if they have inverted, flat, or everted nipples. So then we can assess that. Okay, so on our latch score, there is, let's see, we have this latch. So we have L stands for latch, so it's from 0 to 2. So they get a 2 if they grasp the breast, tongue down, lips are flanged out, and they are rhythmically sucking. A stands for audible swelling, so none noted, they'll get a 0. A few with stimulation, they'll get a 1, or if they just spontaneously go ahead and start to suck, then they can get a 2. T is your type of nipple, inverted, flat, or everted. Then D is comfort. Do we have engorged, cracked, bleeding, large blisters or bruises, or mom has severe discomfort with breastfeeding? Or are they soft and non-tender? H stands for hold or positioning. So no assist from staff, mother able to position and hold infant, then she would get a score of 2. That usually is on your first initial newborn assessment.
So if they're not breastfeeding,
you don't have to do it. Nope, you don't have to do that. Okay, so then we're going to assess our mom's bowel. So are you passing gas? Have you had a bowel movement? We'll auscultate her bowel sounds. Moms, especially with episiotomies, are really afraid of having that first bowel movement. So tell them, we're giving stool softeners that will help facilitate that, encourage them to drink more water. And then that's pretty much all of all of that one. Then we're gonna evaluate our bladder for any distension, if it's making the fundus flow deviate. If they're having any burning or irritation with urination, and then their output. Usually at the hospital, just a vaginal mom, we don't really monitor if she is having output. We don't really monitor that unless we have. Yeah, you can have that. So you'll want to make sure that you're asking, do you feel like you're urinating adequately if you're not keeping track of that? Also, you can have, if baby's been born too fast, lots of trauma, so we may have lots of swelling that can cause urinary retention with that too. So say you have a mom that says, I've had to pee like 10 times in the last 20 minutes, but hardly anything comes out. Probably have urinary retention, and we need to report that to the doctor. Okay?
So would you immediately catheter
We'd probably get an order first.
Get an order,
Catheter,
okay.
Yeah. So hopefully you can get a hold of the doctor pretty quickly. But in that situation too, that you might just have to go to the on-call doc. That's, like we have an on-call doc in the ER, so we might just have to get just an order from him really quickly. Okay. So then you're going to evaluate her pain, location, character, severity of pain, and describe your interventions. So what can we do for our interventions if we have pain?
Reposition.
Okay.
Warm.
Maybe ice packs to the perineum if that's where her pain is. We could do even oral medications, so maybe Loratab or Percocet, something like that. What is most of their pain going to be feeling if they don't have a episiotomy?
the uterine contractions?
Yes, so uterine contractions, so may feel cramping. That's probably what they're going to.
How often are we supposed to per day?
We usually do it every